Welcome. This is the sneak peek to our fascinating solution and platform that we created for menstrual cycle and the well-being of women. It's called March Health, and this is the release of our MVP version of the app. My name is Negin Shiraghaei. I am a former journalist. I've been working on women's rights and I've been an activist and advocate for almost 2 decades of my life. And I'm a co-founder of March Health alongside Mark. Mark?
My name is Mark Amouzgar. I'm an engineer with MBA. I've been lucky enough to be part of this great team for the last 1.5 years. We have great news to share with you. Today is a great day for us. After 1.5 years, we have a product to launch and a great one. So thank you for March Health's team, and thank you for everyone watching us right now.
It's been a fascinating journey. There were a lot of ups and downs, and we're so happy that we ended up here because we started somewhere and then we developed to something much bigger. And we're really, really passionate about where we are standing now and the vision we have for the future. It's really close to our heart. It's a personal passion of mine and Mark, because the effect of it, I've seen it in my personal life. And Mark, as someone who has a partner, female partner, who's going through the menstrual cycles, he has a personal story too. So for us, it's something that we were facing on our daily life and personal life, and we decided to do something about it and change it. What is the problem? The problem is, as if you're a female out there or someone who menstruates, you understand that the solutions that are out there and the problems that happens in your body or the changes that are happening, it affects your life on a daily basis. But when you look at the market, there is nothing that addresses this complex issue as complex as it is. So there's no complex solution. What do I mean by that? The cycle doesn't happen when you're bleeding. It doesn't only happen when you're going through ovulation. It happens every minute of your life throughout these many years that you go through the cycle. So the changes that are happening, for example, some women have PMS or severe cases of it. Some women have really easy period pain. They don't even have a pain. It's really easy. They don't even see it. But even all of these can change throughout years. So, but our understanding of this, it's almost non-existent because we don't know what happens in female body. The pharmaceutical companies, there's this understanding that the female body is so complex that they don't even want to touch it. When there's a trial on a drug or something as complex as that, or like a vaccine trial, they don't want to even go to do the trial on women because there's so many other factors in play that we still have no clue about it. And that goes to data gathering and a lot of different complications out there. So we decided we need to do something about this.
We came up with a solution, with a holistic solution to approach menstrual pain and menstrual wellness as a whole solution. As part of that is the most important part is the physical pain. So we've decided to come up with a wearable 1 inch by 1 inch, the thickness is 1/2 inch, which mutes the pain. And also we have a solution for the mental discomfort, which has 2 parts, emotional and psychological. And we have a couple of features in the app that can help to increase the quality of life for a menstruating person.
This is, Mark, I think I cannot stress enough on why there is a need for a complex, holistic solution out there, because it feels like there is this fascinating poetry that talks about this elephant in a dark room, that everyone touches it from their own point of view and understand it from their own point of view. And nobody sees the whole elephant. And this is how we see period pain and menstrual cycle. We don't understand it as a whole, and we don't address it. So when we are talking about period tracker solutions that are out there, they talk about just tracking your period. So if you have a pen and a paper, you can do that almost. They're a little bit more advanced, but still the concept is only that. When we are talking about the painkillers or the pain solutions out there, they're mostly relying on chemical solutions. And then almost none of the solutions out there are understanding the complexity of the issue and addressing the different layers of these problems. We want to change that, and we believe that we can do that with the help of our community, with the help of people who are going through the menstrual cycle. And we believe that the solution should come up from the community, because data and understanding is the essential part of the future. And the hope is that we can, with this three-part solution, in the future, we can create something that the next generation doesn't need to go through the same ups and downs that we women have been going throughout history. And hopefully they would have an easier and a better quality of life.
So true. This is what I think as a male and as someone who has been working in this space for years, that menstrual and the importance of basically talking about this topic is not just for females. This is not just females' issue. This is everyone's issue, because either I am menstruating or I have a loved one who does. It affects people in everyday life, in an individual level, in a family level, in a society level, for businesses. So we want it to be part of the solution, not part of the problem. That was the reason that we decided to start this business. And we believe that the world is waking up to a new dawn, and women are making rightful demands, and with different movements that we've seen so far in the last couple of years, including Me Too movement, other ones. And we are going away from that hush-hush culture that we had earlier. From early age, women are thought that they should not talk about period. I don't need to tell you that, but in a lot of cultures, when young girls get her period, they face with the pressure from the society, even sometimes from their own family, and the hush-hush culture that we are talking about. So in the app, in the mobile application, we are addressing some of them with putting that individual as a center. So with bringing human-centered design to our product, we are hoping to address some of the problems that we are talking about it right now, Negin.
Yeah, and I'm really happy when you and me, we are going to meetings with investors and with partners that we want to partner with. I'm fascinated by the response we are getting. It's that passion that other people have as well now. It's something that I wouldn't imagine would happen like 10 years ago. There's that awareness starting, that people are more understanding this, but also what really makes me happy is that seeing that people want to take action. It's not just talking about it anymore. They want to change the scene. They want to do something and take it upon themselves to actually go out there and change it. And that's why we managed to partner up with a lot of influencers that are coming out. We haven't launched that yet, but we are lining up a lot of fascinating influencers that the names are coming out, and you're gonna love it. And also a lot of really good NGOs around the world. Some of these NGOs, the groundbreaking work that they're doing, it blows my mind. And I'm really happy that through this, we are partnering and we are helping women around the world to go to have a better life and have an easier life.
Same here. We have partnered up with a couple of great NGOs in the US, in East Asia, India, Africa, and in the Europe and Latin America to address and partner up with them. So one of the questions, Negin, that people ask me as one of the co-founders is that why did you decide to come up with the name March and put the name March Health as the name of the business? As the noun, March is a month. So we are in a monthly cycle, and it's the start of the spring, which is for being fertility and being fertile. And also it's the start of the nature cycle, starts from March and the spring and goes on to winter. And as a verb, it brings action, it brings awareness. So let's march for women's health, let's march for women's rights, let's march for women's equality. And as a brand, we believe that the easiest way to maximize the impact is to build a community. And the easiest way to build a community is to connect that community and the brand and the business to a bigger and higher cause. And the cause that we want to connect ourselves to is women empowerment, and making sure that through the partners, through the NGOs that we are partnering up, even the ones that cannot afford our premium services, they can use that all around the world.
You talked about the cause. And you mentioned the holistic approach that we have, the three pillars of that approach. I think we can show the features to the audience. So what I want to emphasize is that these three pillars are really important, because as someone who goes through the menstrual cycle, you might go through pain. Not everyone goes through pain, but the pain solutions matters to be addressed, as well as getting the emotional support from your partner or the loved ones who are in your life. It works both ways, as Mark mentioned, that it's not just only for the person who's going through the menstrual cycle, it affects the people around them as well. And also the discomfort, the psychological discomfort that as the person you're going through. So we wanted to have a solution that addressed all three of them. Mark, we have a video about that as well, right?
We do have a video. Before going to the video part, which I will share with our audience in a minute, I want to tell that now that people are paying more attention to these issues, we need to normalize talking about women's health, including period. As we speak right now, Negin, there are more than 2.2 billion people menstruating this month. And from them, 75% of them, they experience mild to acute period pain, physical pain. And almost everyone, 93%, they experience some sort of emotional or psychological discomfort. And we have a solution to address that. If you have pain or you know someone who has, this might be a good solution for you, which is available right now on Google Play. In the subscription, you can see the link for Google Play, and our iOS version is ready, will be released today by end of the day, or tomorrow, probably in the next 24 hours. So we are hoping to get your involvement, build a community, and then do our part, move the needle a little bit.
Okay, perfect. So let's see the video, Mark.
Sure, absolutely. So why? Go ahead.
Perfect. So this is, I think the sound is not working, so I will take it upon myself to explain a little bit, and then Mark, you can chime in as well. So there's a personalized solution that like advices that we are giving. There's also the loved one support that we talked about, the emotional part of the app, that approach that we have. This is what you can do as a loved one. You can log in. We also have the medical support. Do you want to chime in on that, Mark?
So this is basically a telehealth, offline telehealth version that we have, that you can ask any question that you have with your name or anonymously from our doctors and the gynecologists and OBGYNs that we have as part of our team.
And the cycle tracking is something that you're really familiar with. There are other solutions similar to this out there, but then for us, understanding the data gathering is the aim. And then we have really interesting options in there that encourages you to log your information. And the Health and Insight report, which is Health Insights report, which is really useful because that's something that we need. We need to understand the patterns and then point the dots together and see the bigger picture. And that's something that you can share with your doctor on a personal level, and they can understand what's happening in your body. This holistic approach is something that is a base of our vision, and we want to share it with everyone around there so we can build something that actually help people. So, Mark, where are we going from there now? What's the future? So people can download the app now by clicking on there, but we are doing much more than that.
Yes, we have tons of great new features in our innovation pipeline. We already, our great development team already working on them. And we will have releases every couple of weeks. We will have a new release, either improving the app that we have or bringing a new feature to the market. But right now we have 5 features, which talks about the 5 benefits that we add to the user. We talk about the underlying health conditions, the health insight, the report part, which is very, very useful because as a menstruating person, you want to know what is happening in your body and get a better understanding of your symptoms. You can connect your patterns and see that for yourself. And also we help you with that. We understand your symptoms. We understand your patterns. Our development team has designed a system in the back end, an AI-powered system that can tell you if you need to see your doctor about one of your health conditions. This is one of the features that we are working on that, and we have a small version to release, and we will go from there. Another one is cycle tracking, as you mentioned. And the version that we have right now, we do all the period tracking, everything included. And on top of that, we are adding new features as we go about different parts of the cycle, including a pre-cycle part, including fertility part and other parts. We have personalized smart tips and recommendations for a menstruating person to improve their quality of life. This is for menstrual stage and also premenstrual, to improve the quality of life. How? Let's say Sarah is menstruating and we are getting data from Sarah, daily data, daily check-ins. And then we tell Sarah, okay, based on your symptoms, based on the information that we have from you and data that we've gathered from you through yourself, if you do A and B and don't do C and D, you will feel better and you will have less pain, less physical pain. This is the next feature that we have, is about that loved one support. That, let's say you have a partner. Let's continue with Sarah and Sarah's example. Let's say David is a partner. We ask David to download our app as well and sign up as a supporter. And we educate David how to be a better partner for Sarah. We educate David about the things that Sarah expects him to do and not to do. And in general, we educate David to be a better and more supportive and more understanding partner for Sarah. This is what we have so far. From here, we want to make sure that we are focused on the community. We want to listen to you. We want to hear from you. We need your help for our future features. Tell us what you need. Tell us what do you want us to focus on. And you can always go to our website, march.health, or you can email us at info@march.health, or even email me or Negin or any other team member directly. You can email to mark@march.health, or check the subscription for more information about how you can connect with us. We need your help. If you are in the US, if you are in any country all around the world, we need your partnership. We need your help. We want to make sure that we have partners in every city, in every state, in every country all around the world. So please reach out to us for partnership, for distribution, for future works, for local events. And we are here to support our community and make sure that we move the needle and we are part of the solution.
And our refunder campaign is coming up really soon. So that's a really important part. If you want to get involved, that's something you can do. You can get invest in our company. And also, it's not just that, it's spreading the word. And as Mark mentioned, that it's important to talk about the issue, raise the awareness, and that's what we do with our partners. It's not just about us, it's about every cycle. So awareness is the key in this period. There's some questions that we have, like people send us beforehand. Do you want to go through like 3 or 4 of them, Mark? I can ask
Absolutely.
them if that makes it easier.
Absolutely. Let me check those questions that we have right now. Oh,
so
go ahead. You want to go?
Yeah, one of the first one is like if the app is available for free, which is yes. So like any other app at the moment, there are tiers for it. So you can have access to the limited version that is free. You can also get better access to some of these features that we talked about, that you pay for that. And then you can also use some of these, the core features are free and you can use them, but then there are tiers and then there's a premium account for it as well.
The one thing that I want to add here is that, so our solutions base is a mobile application, and which can get connected to different devices and different wearables. And we have also our own wearable to address that physical discomfort. And our wearable is in the manufacturing phase right now, and you can pre-order the wearable. It mutes the pain, and as the efficacy of the solution, we've conducted extensive series of researches and focus groups to develop both wearable and the app. And the technology that we have is named 2020 Startup of the Year by different awards. And we are partnering up with different universities for the future development. So if you are a part of a university, if you are a faculty member or working on a research group, there might be a chance for partnership over there. Please reach out to us. I'm going to go to the second question. If
I can ask it from you. Shall
absolutely, go ahead.
Okay, so what's the difference between the premium plans and the free plans?
You basically answered this question in the first part, but to add on top of that, you can use the core features for free. We have the premium version for more insight, to have access to our gynecologists and OBGYNs for the health insight, to ask questions and others. This is a part that we have premium version, and our premium version is very affordable. We have two packages, $5 per month and $10 per month. If you want to pay annually, you get 2 months for free.
Yeah, and the $9.99 per month, you can get the wearable as well, right?
Yes, we have. You are pre-ordering the wearable, and then it has its own basically process in that. You can find more information at march.health about how to pre-order the wearable.
Yeah, there's a question about the difference that we have with other apps that are out there and why they should switch, which I talked about it a little bit. The main thing is there is nothing like us out there. The truth is that, as bluntly as that, because there are period trackers and there are pain solutions, and most of them are addressing only one part of the issue. There are a couple of them that are trying to combine one or two other aspects together, but none of them have this holistic approach at the moment. Anything you want to add to this, Mark?
No, that was perfect. It's all about who is your user and customer and how you want to help them. For us, that menstruating person, that individual is the center. And we have designed our product, our solution around our user. We want to make sure that with the holistic approach that Negin mentioned, we are helping our users, we are meeting their needs and their expectations, and we are helping to actually improve their quality of life. There are players out there, period trackers out there, that they have millions of users. And when we talk with their users about whether that is specific app or apps, they're changing that user's quality of life, always the answer is no, because they gave their users the option to be in control, to track their period. But on the other hand, we are in the business of improving the quality of life for individuals. So that can be our main difference. And also we have the compatibility with different wearables, including our own wearable for muting the pain.
I think we have time for one more question. Let's talk about, I think this question is really good, that what are the things you think a woman might need during their period? And then how did you get that result? We did a lot of surveys and focus groups, right? It's been like one of those things that built the company like based on that, because it was important to understand what women need. And that's why we did like around 343 or something surveys between 105 different focus groups, I think. What we realize is that 75% of women are with partners who are vastly uneducated and unsupportive when it comes to period pain. 76% of women do not have immediate access to OBGYN, which is a massive issue, especially in the countries that they don't have national health care. And in the countries that do have national health care, it's super difficult to get referred to a specialist. Then 86% of women experience excruciating pains during their period. So you can see how our approach is actually connected with the feedback and what the audience and our market needs and what they're asking for, and the need that hasn't been addressed yet. We still have time for one more question. Shall I ask it, Mark, and then you answer?
Sure, please.
Why does March Health needs data, or like the client's data? Why you are focusing on data that much?
That's a great question. So let me put it this way. With partnership that we have and establishing more partnership with different universities, we can not only help menstruating people to have less physical and mental discomfort when it comes to menstruation. But also we can help with the science and technology part. Let me give you an example. Right now, 1 out of 10 women, they are suffering or experiencing endometriosis. 220 million people all around the world. It's a huge number. And the time it takes to get this disease, this part diagnosis, 8 to 10 years. And there are two main reasons for that. One, the gynecologist doesn't have access to the body's behavior during cycle. Two, that individual cannot connect the symptoms and dots and see the pattern that I might have this underlying health condition. And with the data that we are getting from the users, with the basically AI engine that we have, potentially with partnership with different universities, we can do something about that. This was endometriosis example. There are other underlying health conditions that we also can create a specific focus group with the partnership that we have with the different universities to address them.
Great, right on time. Thank you so much for being with us today. It's been a pleasure having this opportunity to talk about the passion of us and something that we've been working really hard on it. And hopefully you would download our app and help us to improve it. And see you on our WeFunder campaign as well. Yes,
please subscribe to our channel right here. And then stay tuned. We will have more live events, more releases in the coming weeks. And stay tuned for our WeFunder campaign. If you want to join our business, join our backend team. And also, if you have specific ideas, reach out to us and let's be part of the solution. Thank you so much for everyone. Have a great day and night, and talk to you soon. See you soon. Bye.
Bye.